Doc, good morning. It's Tuesday morning here on Culture Daily. And this morning, we started off by cutting off or amputating emotions. Yes, Lenny has cut off a few of emotions. She's cut off. Have you amputated any emotion of yours?
Oh, in situations you have to.
Which emotion don't you go back to ever again in your life?
I don't think I say you won't go back to any. But you have to know what emotion to feed.
Shielding is amputating.
The thing is, every human being has anger, love, kindness. We have all these emotions, but it's up to what you feed. So, at what point are you feeding what? Right now, if you are feeding love and your bank account doesn't match, and you're passing.
Have you amputated love? Have you amputated heartbreak from yourself?
Oh yeah.
Aha, he's amputated.
Cat gone pushed away.
Have you ever been heartbroken?
Yeah, once.
Thank you. Oh,
but it has to happen to you once in your life.
Just
especially
once.
as you're young.
You can't allow it.
If it happens to you twice,
then you have a problem.
Then we have problems. So
yes, heartbreak is once. The rest lessons.
For be shaggy, shake you.
I've experienced quite a number of them. I'm a lover, so no.
Think a day of friends, but no feature of.
Oh, Charlie. Hey, you see, if you watch it,
did you listen earlier?
Please, I beg you. We don't have much time.
That was so me.
But let's get into the conversation real quickly. This morning, Doc, we are looking at amputation, and it is as though it is something that is unspoken of, or it is not close to you until you have either a family member or a relative or a friend who goes through it. Then the shock really hits you that wow, something has been cut off from a limb, has been chopped off from someone,
right,
through various reasons,
right.
But let's first understand what it is and what gets doctors to reach a point where they have to sever that point of your part of your body from you.
Right.
Are you signing the check?
Amen. So basically, let me give you this scenario, right? It's this: we don't take that decision lightly. To consider amputation is to consider saving somebody's life. It's a last resort. So it's two things: either we take the limb or you die.
Okay.
That's the two things. So we're doing it to save your life. We only do it to save your life, not for cosmetic reasons. Right. So imagine the same thing a farmer would do when he has a tree that one part of it is rotten. He cuts the branches off to save the whole tree. The same thing. We're cutting a part off to save the whole body. But it's not, as you said, it's not a decision that is taken lightly. It's a decision that you can refuse.
Okay.
The patient can refuse. It's not enforced. Our job is to give you the pros and cons, give you the understanding of why we are doing it, what we need to do, and what happens if you say no, and what happens after you say yes. Right? In the case where you say no, we can go to your next of kin. Because either we take it off or we save to save your life, or we leave it and you die. In certain scenarios where due to infection, we can try certain plan Bs, such as maybe put you on heavy antibiotics or medication to try and see if you can recover the limb. Or we do revascularization. Maybe the limb is dying because blood is not able to go to that area. So we can try and do some, that's when the vascular surgeons will come, those who deal with blood vessels will come and try to bypass the whole system and try to send blood to that area. Right. Yes. So
is there any counseling that is done for the people who are going to get amputated?
Yes.
And then also for their families as well, so that they understand that this is the severity of whatever is going to happen.
Are you checking?
Yes, it's a post-op. It's a post-op. This one.
Are you checking what the situation is around amputation? So when it gets there,
God forbid. Please,
God forbid, but get your counselor on standby.
So yes, wow. we get the family involved because, as I always say here, medicine is a three-pronged approach. It's your family, the patient, and the healthcare provider. We need the whole support system, because if you are going to lose a limb, maybe you are the breadwinner or you do certain activities in the house, we might need somebody to come in to take over that role. Or the cost in relation to getting a prosthesis, which is an artificial limb attached, is also part of it. And also to get a psychologist involved when it comes to the mental aspect of it, dealing with it, because there are situations where the limb is taken off or amputated, for lack of a better word, and the patient still feels pain as if the limb is still there. We call it the phantom limb pain.
So we're going to come to that.
Yeah, so there are scenarios like that. Another thing that we should also understand is that there are different various forms of amputation, right? And why we are doing it. Because there are instances where we are removing because of disease. The part of the body is diseased and there's nothing we can, it's dead tissue. So you realize that we do something called debridement, where we cut off the dead tissue until we hit blood.
So the dead tissue has no blood?
It has no blood in it. That's why it's dying. If you reduce oxygen to a certain area of your body, that area is going to die and necrotize.
No blood at all, nothing?
Yeah. Blood contains oxygen, all the nutrients to vascularize an area. So it's like you stop supplying water to a certain area of Accra, there's going to be problems. Or a certain part of your farm, water doesn't reach there, you're going to have farming.
You said scraping off the dead tissue.
Yeah, we cut off here till you hit the blood. We do it for wounds too, debridement.
Yeah.
Right.
So Doc, if you have to keep cutting until you see blood, right? Is there a point that you decide to stop?
No.
Even if you don't.
So what we are doing, let's say for example a foot, right? A diabetic foot, somebody got injured or got trapped under a car and the foot is dying. We are trying to prevent the amputation part. So we are looking at, can we save it?
Okay.
So that's the first step. You are trying to save it and see if there's blood, there's something going on. So you go for sensation. You pinch it, you apply heat to the limb and say, do you feel this? And try to see if the patient. Some patients can fake it because they don't want to cut off the limb. So you say, do you feel this? Because you can see you doing it. He says yes. So then you ask him, which part of your foot am I holding right now? And maybe that time you're not holding anything. I'm not touching the leg. They say, oh, it's my big toe. They lie. Right?
Yeah.
That's our ways we go like to bypass the system. Another thing too, you should know that we also, there's a situation where the person can have a tumor, a cancer on the bone, a growth on the bone. That needs to go away because it will spread to other parts of the body. So we have to amputate. Another part is when you have severe trauma, like I said, crashing, industrial, something fell on the person's leg and crashed the bones into pieces. There's nothing, we can't put a bone back, we can't do it. The skin is then we like road traffic accidents as we have here in this part of the world. I realized that I used to hear these stories where motor riders don't, or lack of a better, Okada riders, when involved in an accident or road traffic accident, don't want to go to 37.
Why?
I hear that because we know they are reckless, they will cut it off by
time no day.
So even if we can option?
No, not that was the option. It's a let's not put that on 37.
Let's not put that on 37.
But the thing is that they can be so annoying.
Oh no, not 37.
It's so annoying that when they get an accident, they come to the hospital. It's no mercy. Like let's cut it and prevent you from going back to go and even do the recklessness again.
No, but I'll explain why the story came about. So that's a bit of truth and a bit of untruth in the sense that. Look at that situation. Most of the time when these riders are involved in accidents, it's bystanders who bring them to the hospital. So the question becomes, who's putting a bill for the surgery or the procedure? Secondly, when their colleagues, riders, are the ones who bring them to the hospital, they themselves sort of leave them there and they walk away. Say, we're going to get a family member, they don't come back. And here's the case. I mentioned that the bone is rotten. We need to do something, intervene, right? Maybe at that moment we could have intervened and done something if we had the funds to do that. Or the go ahead to do that, right? But here's the case: the person can't afford the procedure, can't afford anything, and there's not much you can do. So the person sitting there, things are happening to the person, and by the time you get to the end of it, by the time they gather their funds and do everything, there's nothing, we can't save the foot. And sometimes in actual fact, you can't save the foot. Because some are so severe, those who end up under cars, where they like it's crashed. So yes, there's not much you can do. So there's an assumption that when you come to hospital, we go straight to amputation.
Let's ask, because of time, let me ask you about parts of the body that can be amputated and why, and if the word amputation only fits for limbs.
Yes, we can amputate. we can have a natural amputation, in a sense that maybe you work in a factory where a cutting machine saws off your hand. Right. In that situation, if you saw off a digit or you cut off a digit, if it's warm, you have less than 12 hours for us to reattach it.
We're going to ask about the reattachment as well. So
if it's on ice, you have less than 24 hours.
Wait. If it's on warm,
like let's say it cut off and then you picked it up and you rush to the hospital, it's still warm.
I beg to ask.
So you have less than 24 hours.
Let me sound. I beg
but if you preserve it on ice,
viewers, I beg you. Let me just sound some way. Can you reattach a cut off, a warm cut off manhood?
Yes, you can.
Hey.
But it's not, thank you.
We can attach, but as long as it's still, it takes time for it to die.
So and it will function back again.
You might not get 100%, but you get close to 97s or 90%.
Do you want it there or you don't want it?
That's the good question. So you see why I say amputation. Amputation is either you want it or you don't, and then you die. So
what about again? And I'm asking these body parts for women as well. Let's say they're melons. That's the breast.
Yeah,
it can be fitted back, or not.
That'll be a difficult, challenging one because we are dealing with a lot of fatty tissue.
So it's muscle that can be put back.
Muscle is easier because it contains nerve endings and blood vessels running through. But breast, it could be possible within a time frame. Could be possible. I'm not seeing it being done. Off? Yes, but how do you cut off a breast though?
Yeah.
We're playing and then.
Playing with what?
What sort of playing is that?
What kind of game was it's better to ask. Guys, I thought that it's better to be foolish than be useless. So yes, let me be
another thing to that I realized somebody was asking me was that what happens to the limb, my limb, when you amputate it? In our part of the world, you can actually choose to keep it. We are allowed to give it back.
I've seen that before.
We can give it back. Your leg, we can give it back to you. Also, in the hospital, we can keep it in the morgue, and then after a few days or so, we incinerate it or cremate it. Now, another thing you can't do is that you can't cremate your own limb. You can't take it to a crematorium and go and cremate it without a death permit. By law, you can't do that because we only cremate things that by law. We only bury things by law that have a death certificate. So somebody can die in your house and you bury the person.
That's murder.
Exactly. So you can't, though you have the limb, we've given it to you, then you just go somewhere and just go in. If you are caught with that, you can be jailed for it.
There's a criminal intent.
Intent. Because number one, where's the limb from?
Yeah. Doc, so what about which parts can you amputate?
We can amputate your hand, your foot.
And then yes, in the amputation of your hand, for example, I know that there are lower, but was it parts? Is it
lower arm, upper arm? So we are talking about upper arm. We can amputate above the elbow, right? So from this direction, above the elbow, we can amputate wrist.
Okay.
Right, close the wrist. So that's why you hear the term during the war.
With the war,
yes. We used to hear short sleeve, long sleeve.
Yeah.
But also we can also amputate due to a malformation.
Okay.
I had an X-ray back. I don't think we can show it. Sometimes due to bone growth, you can have somebody have like 3 fingers, like 5 toes and 6 toes and all that. We can amputate the extra digit. Okay. Right, because a malformation of a bone. Right. Another thing too, but most of the time, what happens in this part of the world is the diabetic foot that we do. We do amputate the diabetic foot because most of the time they come, most of them don't get treated, most of them don't get diagnosed with the diabetes. So they are not on treatment, they are not on medication. And it takes time for the diabetic foot to heal. Which like another time we talk about diabetes, we'll go into why like it doesn't heal quickly. Because even when you get injured and you come in, you are diabetic, that's where we do a lot of the debridement. We try and get blood flow in that area. So sometimes the first time I saw a diabetic foot during my medical rotations was that they were doing it and the patient was not even in pain. Like it was just foot was just there.
So with that they don't need any injections or anything.
Yeah,
so
that
brings.
But we're looking for a sensation at least.
To see if it can be salvaged.
Yeah.
Doc, I want to ask this question about what do you do to when you amputate, a limb? If it was a natural occurrence, maybe a machine or something cut me, how do you seal off that part so that you don't have, because that's a lot of blood that is, even just a little cut on our skin, and look at how much blood we are losing.
Yeah, I wish I could show animation, but I'll try and talk it through. So let me use the paper.
Should we show it? Because
we have an animation for it. I have an animation that's not graphic. There's an animation that's
a bit graphic. We apologize. We don't want to stir up any emotions now this morning, so please pardon us. So let's describe it.
Let me describe it. So for example, you have a limb like this. Sorry, I'm using my pen. Okay, let me use this. Right, we
can use Lenny's hand and break it.
So let them use this.
So we have a limb like this, right? We're going to make an incision. We're going to get rid of the top part off, right? But you need extra skin to create a flap over it, right? So you can't just sort of cut off the diameter off and just take it off like they're cutting a yam, right? So you need a flap. So in the sense that if I make an incision, I'm going to make sort of like a V incision. So you're going to make an incision this way and that way. That will give me enough flap to close it off and stitch the ends and get like this.
Oh, that's why sometimes you see the top part there with the bit of incision.
Exactly, like stitch it there like that. Okay. So you can get this way, or you can go an L where they cut it this way and then they fold this on top of this.
Okay, so it's never a vertical slice.
No,
it's horizontal.
No, you only do that. You always need to leave extra flesh for you to stitch. Because if you cut that way, there's nothing for you to hold. It's like what's the those doing? I heard this morning you're doing fashion now. Congratulations with that.
Thank
I know you guys leave allowances for you to stitch. Well, the seams, right? You always need extra cloth. You don't really measure the whole, like don't use to the edges, right? You always leave sort of allowance. Exactly, that's the way. So we need that allowance to be able to do that.
Word of money in his allowance. Anything that money she's into that business.
Allowance is just the extra fabric when you turn.
I know. I'm just saying that so far as that word represents money in a way. Or allowance.
So with the men who wear trousers, you see that the seams of our trousers, there's always this flap. Yeah, that allows you to extend if you want to. So the same way we go about it, because if you get it too close to the edge, that's why I'm saying that it's easy for us to.
Let me understand this. So if you are going to, let's say, amputate this arm, God forbid.
Yes.
You are going to cut L like this. Can we just have the camera show on me this way? So
they are going to cut the top
I just want to ask. So are you going
shorter
to,
than the long part? Then they fold it on.
Yes.
They are going to cut the top.
So let's use your bone as your barrier.
Your arm.
Let's use your bone.
That's what I'm saying.
And then probably leave the back part longer.
So they chop it halfway through.
Yes.
And then
they extend it. Yeah.
And fold it on.
So it means that it's likely you're going to have some small XSB to clean up and all of that.
We make sure all that is taken
care of. Now what I want to ask is that they say that when you have excessive bleeding, you can actually die or pass out.
Yes, you can.
So when you are cutting somebody, what are you doing to replace the blood that is being lost?
Usually this is why every time we talk about people knowing their blood group is important. We do tests before we take anybody to theater. We know your blood group, and we've got blood on standby. We request blood from the blood bank on standby, or sometimes we have your family donate.
Okay.
So we replenish what we are taking from the blood bank.
Okay. Yeah.
So we have blood on standby for you, and we have plasma and other what do you call it? What is the word? The word.
Brain fat.
What happens when you are bleeding and it stops? What's the word for it?
What?
Coagulates. Yes. Sort of. You have we have a mechanism inside your blood that allows it. It forms like a mesh over wounds that helps it to stop the bleeding.
Okay.
Right. So we have plasma and things that help to do all these things to replace whatever we are losing, because sometimes people can lose as much as like a lot of blood, especially if the patient has a certain prior condition, such as he has clotting factors that has an issue. For example, you are on. That's why before said you can't be on drugs like painkillers.
Yeah.
Or blood thinners.
Blood is not.
Or you're taking alcohol or you're not clot. That's a very difficult situation for us, because it's important that your blood starts to clot, because it helps with the healing process. Now, amputation is not done lightly. It's a serious decision that is made, because post care is very important. How you take out the limb, whether you're going to get prosthesis, walking stick, or whatever.
I wish you'd save that, because I want to go into a part of that conversation, because there's a lot, because of the time, there's a lot to look at that, the post care for amputation. But just to wrap it up, Doc, coming back to the types, you were giving us, how they do that, but talking about the blood bit, because like I said, when you only mentioned that you have blood on standby, but the second you start chopping, blood. That's part of surgical practice. We do suction, so there will be always blood filling the area in which. But considering how fast blood moves through our system, when it's being pumped, when you cut such a big,
that's how we use. I didn't say. I wanted to bring.
Are you bringing blood?
I was going to bring one. We have
one arm amputated.
No. we have something called a cauterizing machine, right?
Okay.
It's like a cutting machine that whilst you're cutting is burning and singeing off the blood vessels.
Aha.
So it stops the bleeding.
Okay. I thought maybe they were going to.
Oh no. We don't. Those times
to slow
butcher style.
Aha. So how is it?
Yeah. So those times doctors were called butchers.
Okay, so then we will now go into how it is done proper. Right. So we'll save that conversation, and then the post care for next week, because of time. Our time is, but this is quite a very graphic.
It's very graphic. So when I saw the topic, like my heart goes out to anybody living with a family member who has lost their limb, had their limb and lost it, or somebody due to polio had to lose it, or accident has lost it. Any person living right now, they are called disability, or can we still use the word disability, or right now we are physically challenged?
Yeah, physically challenged.
I think
we don't use disability
anymore. So persons that are physically challenged due to no fault of theirs, whether disease, infection,
or
accident,
differently
able. Yes. So my heart goes out to you, because it's a daily, to see them smile, it's a lot, like it means a lot to us as doctors, because as you said, it takes a lot of mental fortitude to understand that the things I used to do before, a lot of them I'm not going to be able to do. I might need help in doing certain things.
So Doc, next week we'll look at the process itself. We'll look at the post-care,
and then we'll look at the advocacy for them to do jobs that to be employed.
And then the what do you call it?
Prosthesis.
Prosthesis, right?
Yeah.
And are they?
There are types of prosthesis too. Like there's Lamborghini style, there's Ferrari, and there's Toyota.
It's worth knowing all of
Yeah. There are ones that you wouldn't even know.
There's mechanized ones. It shows your money. Your money.
We're going to look at your money and your type.
You can get wood.
Yeah. Anyway, so it's worth looking into that. But great. So we'll look at that. Our time is up. We have to wrap it up here now on the show. But next week, as we've listed these things, we're going to be looking at that here on Culture Daily with Dr. Chris. Thank you so very much, and have an amazing Tuesday. Stay safe.
Stay healthy.
This is part of our conversation around the fact that there are lots of accidents happening, and we don't want to be found.
And it's wet out there. So people should be those crossing roads. Please use the walkways. Don't be crossing the road.
What?
Yeah,
it's wet out there.
It's a rainy morning.
It's a rainy morning. Yeah.
Jason now was
you're driving like you drive very well.
So people should be using the walkways. I've seen people crossing the roads. It's wet. You slip and you fall.
Terrible,
and
Doc. It's terrible. Please stay safe. You don't want to end up with some prosthesis. You don't want to end up with amputation. You don't want to end up with anything that would bring you to a point in your life where you can be depressed. We'll also look at the mental fortitude that people need to survive this. All this next week here on our Health Conversations with Dr. Chris. Don't go away.